Upstate Medical University in Syracuse, New York invites you to be the informed patient with the podcast that features experts from Central New York's only academic medical center. I'm your host, Amber Smith. Medical students all over the world are looking to improve the health not only of future patients, but of the planet we all inhabit. Through the Planetary Health Report Card, these students are grading their schools on how well they're ensuring the planet's health. I'm talking with two of the leaders in Syracuse, Kathleen, Renna, and Veronica Rive. They're students in Upstate's Norton College of Medicine working toward not only their medical degrees, but also master's degrees in public health. Welcome to the Informed Patient, both of you.
Thank you.
Thank you for having us.
Tell us how this effort began. I understand it was in 2019.
You're right. In 2019, it was founded by a group of medical students through their environmental student organization at the University of California in San Francisco School of Medicine. So that's UCSF. And then early on, to my understanding, they collaborated with Stanford School of Medicine. From what I've gathered, they actually were inspired by an initiative done by the White Coats for Black Lives in 2018, who issued a racial justice report card that evaluated top medical schools across the country on metrics related to racial justice. It's a known fact that the effects of climate change tend to impact vulnerable populations more. So the intersectionality between environmental health and health justice is very strong. And so I think that the purpose of this report card was to kind of expand off of the racial justice report card to include even more environmental health and justice topics.
Do you know how many medical schools participate and where they're located?
The first year, I think they had 13 schools in the United States that took part in this, and Upstate was not one of them. And since then, I think that they've been able to expand to about over 190 institutions, and it's actually worldwide now. So it's no longer just in the United States, it's all over the world. I think there's over 20 countries where schools are now involved.
And it's more than just traditional medical schools, right?
Yeah, it's expanded in that as well. So it first started out just for medical schools, but now there are 9 other healthcare disciplines beyond medicine that have a report card that they are able to take part in.
Can you describe the 5 main categories that the report card measures?
There are several different categories, but I think first it's important to understand what planetary health is. Planetary health is this field that looks for input from multiple disciplines to understand the interconnectedness between humans and our environment. Kind of looks at the ways in which humans contribute to climate change and pollution and ecosystem loss, and how those environmental impacts affect human health outcomes in return. Planetary health itself was a term that was first coined in 2015 by the Rockefeller Foundation and the Lancet Commission in one of their reports. But this fundamental belief of planetary health has been understood and practiced for centuries by indigenous peoples. And so with this definition in mind, it helps demonstrate why it's essential for med students and other healthcare professionals to learn about patients and how they're affecting their environment and how their environment affects them. The report card looks at those 5 different categories related to curriculum, interdisciplinary research, things like that. And one of the biggest categories, I feel, is the curriculum category. We've been trying to integrate planetary health into the curriculum from numerous angles, and we'll go more into the specifics later on. But environmental health topics and social determinants of health are covered during the health systems intensive weeks to get the foundational knowledge. And then we also try to incorporate the discussions related to specific organ systems into the pre-clerkship curriculum to give clear examples of ways things like extreme heat may impact the cardiovascular system, for example. And then there's also like an elective course available for students who want to gain more of a deeper understanding. And that elective you can take whenever, but it's been great to introduce planetary health into the pre-clerkship curriculum. And I also find it helpful just because the Syracuse community itself is uniquely impacted by historic environmental injustices, from the building of I-81 to the pollution of Onondaga Lake. And so our coursework provided meaningful framing to better understand the lived experiences of our patient base that we serve.
Well, you both have led this effort on the Upstate campus. And before we go over the grades for the Norton College of Medicine at Upstate, I want to describe how this report card not only gives a grade, but it also includes opportunities for improvement. Let's start with, what is the overall grade that Upstate earned, and how did you arrive at that grade?
This year, we earned an overall grade of B, which is the same overall score as last year. But when it comes to the individual categories, we jumped from a score of C plus to B in the curriculum category specifically. So while the letter grade stayed the same, it's a much stronger B than last year. So we are improving. And I think that it's important to note the breakdown in the categories and what that shows, which the report card does do. But the report card offers a lot of opportunity to improve by highlighting what we're doing well and then offering ideas for how we can continue to improve on our efforts. So at the beginning of the report card, there's a summary of our findings, and it lists each category's grade, and it briefly summarizes the justifications for why we gave that grade. And underneath that, there's a section where we get to elaborate on recommendations for improvement. So it actually is a great template that we can refer to when we're actively looking for ways to improve our planetary health efforts on campus, because there's a section for recommendations right there. And I think another great way that the report card includes opportunities for improvements is simply by looking through the metrics. So that's how we come to determine the grades for our report card, is that they provide us with metrics in each category, and there will be a set amount. And then based on those metric definitions, we have to go through the curriculum, our campus sustainability office, our interdisciplinary research, and go through everything with a fine-tooth comb and see where we do meet these metrics and to what extent we're meeting these metrics. And then based on that is how we come to the grade. So it's not opinion-based grading. It really is a matter of, this is a criteria they provide for us, and we see where Upstate is falling into meeting that criteria. And then based on that, we have a point system, usually 1 to 3, depending on the metric.
This is Upstate's The Informed Patient podcast. I'm your host, Amber Smith, and I'm talking with Upstate students Kathleen Renna and Veronica Rive, who have helped compile a Planetary Health Report Card. Let's go over the grade for each category. Campus sustainability got a C. The medical school employs an active sustainability manager, and the university is developing plans for large capital projects that will move operations toward carbon neutrality and increased use of renewable energy. Can you explain what carbon neutrality is and what counts as renewable energy?
Carbon neutrality is about producing a net of 0 amount of carbon so that we're balancing out our carbon emissions. What that means is for every bit of carbon we emit, we try to do something that counteracts that emission so that it doesn't negatively impact the planet's equilibrium. So on an individual level, this can be achieved by reducing our energy and water consumption, mitigating our waste production, and traveling conscientiously, for example. And then on an institutional level, something that falls under that category is transitioning from the use of fossil fuels. So that's things like coal, oil, and gas, to renewable energy sources, which are things like solar energy, wind energy, geothermal energy, and hydropower.
Do you expect that the grade of C will rise in the coming years as these capital projects are completed?
Definitely. So Paul Corsi serves as a full-time sustainability manager here at Upstate, and he is heavily involved in the report card process with us. He's one of our faculty advisors. He puts a lot of time and effort into this with us every year, so we definitely want to give him a shout out. But his team also consists of a full-time chief sustainability officer, a part-time co-chief sustainability officer, and an energy manager. And so altogether, they're working super hard to improve campus sustainability efforts, working on things like improving our recycling and composting across campuses, doing waste audits, and working towards integrating more sustainable food services as well. We also have had the development of a sustainability steering committee here at Upstate, which Kathleen and I actually do sit on along with a few other students and faculty members. And we presented last year's report card to them at the meeting, and that helped establish some points of conversation as to ways that we could improve upon for the coming years. And so the Sustainability Committee focuses on things like resource efficiency, infrastructure improvements, and public health engagement by addressing things like waste management, energy use, operating room sustainability, and then their education and outreach. And then the entire SUNY system actually has developed a SUNY Climate Action Plan. So that aims to achieve net zero SUNY-wide greenhouse gas emissions and to switch to 100% renewable energy by 2030. The entire SUNY system has that initiative as well. So between the SUNY system's overall efforts and the hard work and commitment we see from Paul and his team at Upstate specifically, we're very hopeful for this grade to rise in the coming years.
Now, interdisciplinary research got a B minus. What is happening at Upstate regarding research related to the environment, and what could help move that grade up?
Upstate has this whole body of researchers in the Institute for Global Health and the Center for Vector-Borne Diseases, and they're dedicated to understanding global change, environmental health, public health, disease patterns, things like that. These groups also annually sponsor events such as the Dengue Endgame, which is an event that seeks to use collaborative approaches to address dengue as a disease. They also host the Lyme and Tick-Borne Disease Symposium. There are also researchers in the Department of Public Health and Preventative Medicine that are investigating different questions related to climate change, environmental exposures, and their impacts on human health. And so in each of these instances, there's a body of investigators that come from numerous different fields, hence the interdisciplinary research component, and they contribute their unique expertise to understanding these problems. And so to move this grade up, we really just need more involvement in interdisciplinary research. Upstate doesn't really have a centralized way right now to promote research opportunities and projects to students. So it could be helpful to have a centralized opportunities page for projects in this space for students to reference. Also, maybe a criterion in which we scored 0 points is the fact that we don't currently have an avenue for communities who are disproportionately impacted by climate change and environmental injustices to provide input on Upstate's research agenda. So it may be worth Upstate allowing folks in Syracuse some sort of forum to provide their thoughts on what topics should be researched.
The curriculum category received a B. How does the curriculum at Upstate compare with curriculums at other medical schools in terms of offering climate health topics?
Like Veronica said, we've been improving this category. We've been working on this for a long time. It's being integrated into the core curriculum at our school. And then there's this wonderful, the impacts of the climate crisis on health and clinical medicine elective course that Dr. Augusta Williams has organized and leads. We've done a lot of work in this space. And so honestly, because we've made so many improvements, we have been able to fare a little bit better than other institutions. When I took a quick browse last night, I saw several C minuses, several C's, a couple B minuses. So us sitting at a B is pretty good. However, there's always room for improvement, right? For example, Emory University has an A+ in the curriculum category. One of their claims to fame is this longitudinal thread in their curriculum that specifically highlights climate change and environmental health, and it spans all 4 years of medical school. We have our own room to grow based on what we've seen in our report card. We need to do a better job at discussing the impact of climate on mental health and reproductive health and things like that. But then I also think that we can improve by looking at what these other big schools are doing and ways that they're doing it well. We really are focusing on our pre-clerkship curriculum right now, but Emory has this longitudinal curriculum, so maybe we need to start incorporating some of these topics into our clerkship curriculum and things like that.
Support for student-led initiatives received an A- at Upstate. What are some of the student-led initiatives here?
Another good question, and another one that Veronica and I love to chat about. First and foremost, I will say that the Planetary Health Report Card in and of itself is a student-led initiative. Connie was a medical student at Upstate who introduced the initiative to our school. And then even just the concept alone was started by those med students at UCSF. One that we're very proud of is the Environmental Justice and Sustainability Club that Veronica and I were on the e-board for a while. This club has the goal of raising awareness among the broader Upstate community about environmental injustices and educating folks about ways to limit our climate change impact. During our tenure on the e-board with our fellow e-board members, Emily and Lily, in addition to that curriculum work that we did, we were also able to organize a campus-wide voting initiative and a fundraiser in the wakes of Hurricanes Helene and Milton. We organized a lead poisoning prevention presentation and gave that presentation to elementary students in the area. So a lot of both Upstate-centered and Syracuse-centered work. The club is also affiliated with a national group, Medical Students for a Sustainable Future. And that group allows participating clubs to collaborate with other schools and advocate at the federal level for environmentally just and climate-centered policies. EJSC is just a club, and then there's plenty of other student orgs that are working in environmentally friendly work, like the Upstate Community and Wellness Garden, Wilderness Medicine Interest Group. We're also a Bee Campus USA affiliate, which is an initiative that promotes pollinator-friendly campuses, and students put up bee boxes around campus to help on that front. And as Veronica mentioned, there's that sustainability steering committee. And while it was an institution-wide implementation, we as students advocated to be a part of that group. So I think in terms of doing things in the student-led initiative category, we're doing quite a bit, but there's always room for improvement. One thing that could probably be helpful is providing specific grants or subsidies to be used by students to take on research projects related to sustainability and planetary health, because having a default option for participation in this type of research can encourage more students to get involved rather than just relying on students to come up with their own plan and impetus for research.
Well, in terms of community outreach and advocacy, that actually got the highest grade. That got an A. What is Upstate doing in this area?
We're doing a lot. One of the greatest triumphs in this category here at Upstate has been the integration of the CEL requirement into the medical school curriculum. This was created by Dr. Simone Stewart, who's a faculty director in community engaged learning, which is what CEL stands for in that program, which was established during Kathleen and my first year of medical school. Med school students here are now required to partner with local community groups of their choosing for a minimum of 40 hours along the 4-year med school track in order to graduate. This has been really good because it's created a dedicated time and space that fosters collaboration between medical students and the Upstate and Syracuse community members in a way that wasn't done previously at Upstate. So it's allowed us as medical students and future physicians to form deeper community connections and partnerships. In addition to that, we have the annual Lyme and Tick-Borne Disease Summit that's hosted here every year, and that's done to educate healthcare practitioners about the patterns of tick-borne diseases, and the annual Health Justice Conference that always covers topics like lead poisoning and food insecurity in the Syracuse community. We also produce community-oriented publications. So that's things like the Upstate Health Magazine and the Health Link Seminar Series, which address planetary health topics as well. So we're doing a lot, both academically and clinically, and we should be really proud of that.
Do you find that most of your colleague students are involved?
Definitely. So I think one of the greatest parts about it is that as first year students specifically, we hear this CEL requirement, right? And we're anxious, we're nervous, we want to get started on everything that's required of us. And so in a way, it's been able to serve as like a foot in the door. And then once a student has that little push to get into those spaces, once we're in those spaces, I have found from my personal experience, but also when speaking with my colleagues, that we find a place that we really enjoy and becomes our niche, and we develop these deeper connections, as I mentioned previously. And so that makes it not feel like a requirement, and that allows us to continue on in our 4 years, even after we've completed those 40 hours. And I think it's done a lot in teaching students the ways in which health impacts our lives and vice versa, in ways that we didn't historically learn about in the classroom, right? So I think that specifically the community engaged learning requirement has motivated students to be even more engaged than they were previously.
I'm sorry, what is CEL?
CEL stands for Community Engaged Learning. And Community Engaged Learning is kind of what it sounds like. It was supposed to replace volunteering. So when you volunteer, there's this notion that you go to wherever you're volunteering, you serve your purpose, you serve your time, and then you sort of go home. That might be it. You never think about it again. And the whole concept is you served somebody else. You did something for somebody else. And that's not necessarily productive for anybody. Whereas community engaged learning is a bi-directional relationship. We're working together. So we're not just coming into these communities and telling them what needs to be done to make things better, right? We are working together. We're listening to the community members. We're hearing what they have to say, what they want to see, and how they want to go about implementing whatever program or initiative. And then we meet them however they want us to be there for them.
Now, what happens to the Planetary Health Report Card as the two of you move toward graduation?
That's the million-dollar question this year for us. The Norton College of Medicine joined this initiative during the 2023-2024 academic school year. And that was thanks to the pioneering efforts of Dr. Hani Kutsi, who has since graduated and is a resident now, but he was a student at the time. And he had reached out to Kathleen and I because we were serving on the Environmental Justice and Sustainability E-Board. And so all of us, along with Jessica Crooker and John Babbage, who were also students at the time and were heavily involved in Environmental Justice and Sustainability Club, worked together to complete this report card with the support of our amazing faculty advisors, Paul Corsi, Dr. Augusta Williams, and Dr. Travis Hobart. And it's really been up to us, the students, with the support of the faculty, to continue to recruit new students every year, because we also want to make sure that we are staying up to date, right? Kathleen and I are going into our 4th year, so a lot has changed since we were in our 1st year of medical school in terms of curriculum improvements and innovation. So we always strive to make sure that we have specifically MS1 and MS2 students on the team as well. And with us graduating in a year, the topic of sustainability of this report card is definitely something that we have been thinking about and talking about a lot. So we're currently working that out with our faculty advisors, planning on transferring the overall role of responsibility of the report card completion and the recruitment onto them. We just feel it's the safest way to ensure that the initiative is going to continue each year at Upstate, even when all of the original student members have graduated. Part of this transfer of roles relies on spreading the message of the Planetary Health Report Card through venues like this very podcast. So thank you so much for having us. And if there are folks out there who are interested in getting involved in our work or would like to learn more, feel free to contact either me, Veronica Rive, or Kathleen Renna.
Well, thank you both for making time to tell us about this Planetary Health Report Card. I appreciate it.
Yes, thanks so much for having us.
Thank you so much for having us.
My guests have been Upstate Norton College of Medicine students Kathleen Renna and Veronica Rive. The Informed Patient is a podcast covering health, science, and medicine brought to you by Upstate Medical University in Syracuse, New York, and produced by Jim Howe, with sound engineering by Bill Brokel and graphic design by Dan Cameron. Find our archive of previous episodes at upstate.edu/informed. If you enjoyed this episode, please invite a friend to listen. You can also rate and review the Informed Patient podcast on Apple Podcasts, YouTube, or wherever you tune in. This is your host, Amber Smith, thanking you for listening.